it's time to look at the surgical options of arthroscopy and joint replacement. I asked Dr. Steinberg to explain arthroscopy and its role in osteoarthritis.
Arthroscopy is basically a camera is placed into a joint, and in another small incision that's we call a working portal. We can place instruments and shavers in to smooth out the arthritis or clean up meniscal tears, which is another type of cartilage in there. In advanced arthritis, it basically has a very limited role. Early arthritis, a younger patient, it certainly, I think, has a role to kind of clean out or flush out the joint. Again, it's not a long-term solution like a joint replacement would be. And again, in someone with an advanced arthritis, it probably is not a good treatment option.
Now, we've just been seeing David, who was your patient, and he had his both knees replaced. Now, obviously, a joint replacement, I presume, is sort of end of the line, that's last resort, but it's curative. So how do you decide when it's time to do the joint replacement?
Ultimately, I think it's the patient will tell me when it's time. We've exhausted the conservative measures. They're winding up taking pain medication. Their quality of life is deteriorating. They're gone from maybe where they're, can't do their activities. Now they're on a cane. They're becoming more sedentary. And they have x-rays that show advanced arthritis, and again coming back to ultimately is their quality of life is really deteriorated, and that's when the role for a joint replacement comes in.
How often do you do two at once?
Don't do it very often anymore. David was a unique patient. I say it takes a very special patient to do both in the same setting. They have to be relatively healthy. There's studies in literature that'll show if they have any significant cardiac or pulmonary risk factors, that's probably not a good idea to do both in the same setting. The other thing is, again, it takes a special patient. You get the patient that comes in and says, "Doc, you got one shot at this. I want to do them both and get them over with," because it is a tougher rehab. And a lot of times I'll counsel patients and tell them, it's like, let's do one, make sure you're happy with it. You're happy with my work, that you understand a joint replacement before going through with both. But David's done very well. He's a very good patient with us.
And now tell us, how is it done? I know I've got one of my souvenirs from my orthopaedic run just a few years ago now.
That would be a hip replacement there.
That's a hip replacement, that's right. So this little old lady had her hip joint replaced. This didn't do very well, so it had to be taken out. That's why I keep it in my souvenir collection. They're too expensive to give away, certainly back in those days. But let's look at the knee perhaps, since David had his knees done, and walk us through what actually happens with a joint replacement.
Ultimately, a joint replacement, it's a resurfacing. Basically, you're cutting away the ends of the bones and putting on metal components, if you will, and in this instance of a knee, a plastic spacer. So in this knee model, basically we have an arthritic joint, and that's what's being demonstrated with the ends of the bones. It's not all smooth, pearly white cartilage here. And what we'll do is we'll cut the ends of these bones away and basically resurface them. So have here basically the end of what will go on the thigh bone or the femur, and that basically is cut and is fit specially into a joint. And then on the tibia, the shin bone, is a tray that has a plastic component typically. And there's different sizes for this because it's very important to balance these ligaments on both sides so someone has a knee that's stable and doesn't buckle on them. But ultimately, it's a resurfacing. You're cutting away the arthritic portion.
So you cut bone away, put a new surface on. How long will it last?
Most will last 15, 20 years. I mean, the materials coming out now are much better than they once were. So if you're putting a joint replacement in a younger patient, that's typically what we'll counsel. Technology is amazing. It improves all the time, and some of the materials coming out are more than likely going to be better.